Hi, my name is Nina Sanford. I am a GI radiation oncologist at UT Southwestern in Dallas, Texas. And the question for me was, what are some important updates or the most important studies in regards to radiation therapy and GI cancers? So obviously there are many GI cancers, so I'll go through a few of the subsites. Definitely there is a lot of excitement in non-operative management in rectal cancer. So there have been several trials trying to define the best patient population and the best treatment regimen to achieve a clinical complete response, allowing for omission of surgery. So definitely the OPRA study, which showed that long-course chemoradiation, chemotherapy, and surgery achieved higher rates of organ preservation. That's probably the most commonly used regimen. Several other studies ongoing that assess different regimens, different radiation treatments, different chemotherapy regimens are ongoing, and I think those will be reported in the next couple of years. Gosh, there are a lot of trials to talk about, but at GI ASCO this year, there were a couple studies presented in liver cancer that I thought were very interesting. They were both by Dr. Dawson. One looked at the addition of SBRT to sorafenib in very advanced HCC and showed that the addition of SBRT conferred a survival benefit. Obviously, we know sorafenib is no longer the standard of care, but there will be ongoing studies looking at the addition of radiation to atezo-bev, which I think will be very interesting. There was another abstract on the use of single fraction radiation for palliation that showed that that one treatment of radiation, which is convenient and cost-effective, was very efficacious for patients. I think those were the major studies presented this year. Pancreas cancer, a little bit of a landmine for radiation therapy. There have been some negative trials recently, but I think there is a role for radiation in pancreas cancer, and we need the right trials with the right patient populations to better define that. And I know there's a lot of ongoing work in that space. Yeah, definitely a lot more I could talk about. Those are the things that come to mind. Thank you.